Today, I'll be presenting the design for an asynchronous online discussion activity for my course titled Heart Failure, A Race Against Time. This course is aimed at medical students studying the progression of heart failure. In this presentation, I'll be outlining the design of the discussion activity, explaining how it supports learner engagement, and discussing the cognitive scaffold and technology tools used. Our learner group consists of medical students who are studying heart failure disease progression. The overall goal of the discussion activity is to help students understand how heart failure progresses and how early intervention can change patient outcomes. By participating in this activity, students will collaborate to analyze a patient case, make clinical decisions, and reflect on how their decisions align with current clinical guidelines. This will reinforce both their cognitive understanding and their clinical reasoning. I've structured this discussion activity using Mayer's conceptualization cycle. The cycle will guide students through the process of understanding heart failure progression while engaging in problem-based learning. The primary courseware tool will be a text-based branching scenario created in Articulate Storyline and accessed through their LMS Canvas. This will allow students to make clinical decisions for a virtual patient experiencing heart failure. Their choices will determine the patient's outcome, reinforcing the importance of early intervention. A secondary courseware tool will be a discussion forum where students will collaborate to analyze a case of a patient showing signs of rapid deterioration. And the tertiary courseware tool includes embedded quizzes within the recorded presentation to ensure students remain engaged and attentive while learning about the progression stages and treatment of heart failure. The orientation of this activity will be guided and inquiry-based, where I provide the necessary resources and structure, but students explore and apply their learning through discussion and the branching scenario. In terms of technology tools, there are a few categories I'll be utilizing to enhance the learning experience. For content creation, the recorded presentation with embedded quizzes and the branching simulation and articulate storyline will serve to engage students with content in an interactive and applied way. For collaboration and communication, the discussion forum will form students into small collaborative groups where they will analyze the case, share ideas, and provide feedback to each other. They will be prompted with discussion questions to keep the discussion on topic. At the end of the discussion, the group will submit a shared summary that includes a clear diagnosis of the stage of heart failure the patient is experiencing, a list of key interventions that could have prevented progression, and a detailed care plan outlining the next steps for treatment. For the assessment and analytics, the branching scenario will provide immediate feedback, assessing the decisions students make and showing the impact on the patient's outcomes. The forum will also be assessed for participation and the depth of their analysis. The final summary of the patient's outcome will be graded according to a rubric provided to the students. For knowledge representation, decision-making flowcharts or templates will guide students through their case analysis, helping them organize their thoughts and clinical reasoning. Now let's look at the cognitive scaffolds that will support students during the activity. The case study will serve as the trigger event, stimulating critical reasoning as students evaluate the patient's symptoms. The collaborative nature of the discussion promotes teamwork, while the simulation promotes self-directed learning by allowing students to make their own clinical decisions. Students will receive question prompts like compare this patient's symptoms to those seen in early stage heart failure and what interventions could have prevented further progression. We will also provide expert scaffolding in the form of feedback on their decisions in the forum. In their group discussions, students will need to analyze the problem scenario, list hypotheses about the patient's condition, and gather information based on clinical guidelines. Their decisions and analysis will be presented in the forum where they'll be encouraged to reflect and revise their approach. In the collaborative discussion, the students will analyze the case of a patient showing signs of rapid deterioration. The group will work together to assess symptoms, order appropriate labs, and determine the stage of heart failure. They will discuss clinical decisions, comparing findings to current guidelines, and reflect on how earlier interventions could have changed the patient's outcome. This will encourage active participation and critical analysis, ensuring the students don't just memorize guidelines, but truly engage with the material and learn how to apply it in real clinical scenarios. To summarize, this online discussion activity is designed to provide medical students with an engaging and challenging environment where they can apply their knowledge of heart failure progression through collaborative analysis, decision making, and reflection. By using tools like the branching scenario, discussion forums, and expert feedback, this activity will foster critical thinking and deeper learning. Thank you.